Hi, my name is Krysta. You are here in my office in Roseville, California, where I'm a licensed marriage and family therapist. And this is 2-Minute Therapy, where I discuss topics with you in 2 minutes that I would discuss here in my office with clients, but in a shorter format. Today, I'm going to discuss something near and dear to my heart, and it's my hope that it will not only be educational like my other videos, but perhaps this would even be a little different, and that those of you who are experiencing what I'm talking about might feel a little more normal and a little less alone. And those of you who love someone experiencing what I'm talking about might have a little bit better understanding of what they're going through. The topic for today is infertility, and more specifically, what makes infertility so dang difficult to just get over and why it's hard to just get over it. I'm going to begin my timer now. So first, let's talk about what typical loss looks like, okay? In the case of a death or something similar, we have the moment of loss, at which point typically the support is greatest. And that's not a coincidence. That's something that humans have grown culturally over time. The support is greatest at the moment of loss. And then over time, as healing occurs, the support fades. Everyone flies out for the funeral. Everyone is in your home. Everyone is bringing food. It's all happening at the beginning. And then over time, there is this fading into healing. The reason infertility is so difficult to get over is because it is a loss, it is a grief, but it doesn't have a single point in time where you can begin the stopwatch and then the healing takes place after that. It doesn't follow that same trajectory. Let's talk about the typical experience of an infertile person. First, it might begin with pregnancy loss, which is definitely a loss in and of itself, or it could grow slowly over time, cycle after cycle of not getting pregnant. In either case, there's typically some losses around the beginning, maybe multiple losses, multiple pregnancy losses, followed by possible strain and stress with loved ones. Then we have the diagnosis and all of the things that go around getting the diagnosis, painful interventions, embarrassing interventions, blood work, etc. If we continue on that process, we also have the potential for failed interventions. Now, remember, all the things I've just listed, they're compounding. So that single incident lost point in time that we have this trajectory of healing from doesn't ever get off the ground because we have this one, and then this one, and then this one, and then this one, and they continue to compound over time. Meanwhile, through all the failed interventions, you still have things like anniversaries going on of other losses, of other past due dates, of other miscarriages, of diagnoses, of, you name it. Meanwhile, you're also surrounded by reminders, friends and family and baby showers and pregnancy and all the things that you don't have. And you have those monthly cycles or the absence thereof, once again reminding you how far away you are from that thing you want. So you can see how this trajectory of healing doesn't ever get off the ground. In the same way, that process of support coming in when you need it most, that support isn't happening in the same way because it's continual losses compounding on top of each other. That is made worse often by the fact that most couples who experience infertility do it in secret, so they're not getting support. Or even if they seek support, they're not getting the support they need. Sometimes support can be shaming or minimizing, such as advice like, just relax, or it happened to this person when they least expected it, or it's divine will. All of the above makes it feel like it's somehow your responsibility or fault, or it's really not that big of a deal, leaving you ultimately lonely. So again, if we look at typical loss and compare it to this, it's not the same at all. I hope this was helpful for you. I am over time now. Hopefully, if it was helpful for you, like, comment, and share it. It might be helpful for somebody else. And take a look at my other videos. And for those of you who are on this journey, my wishes for you of peace and support for your journey are very sincere from my heart. And thank you for spending your time with me today. Keep what's helpful, discard the rest.